Hello, friends, and welcome to Weekly Witness, Texas Impact's weekly podcast designed to help mainstream Texans of faith understand the legislative process and help you engage with the Texas legislature. My name is Scott Atnip, your host and Texas Impact's Director of Public Witness, and today we're taking a break from the issues of the day in the mess that is the Texas legislature special session. Instead, we're talking about a topic that is honestly not much fun to talk about, but is an issue that has shaken many of our families and communities. We're joined today by Reverend Dr. Sarah Lund, Minister for Disabilities and Mental Health Justice with the United Church of Christ. Dr. Lund was part of an alliance that partnered with the U.S. Health and Human Services Center for Faith-Based and Neighborhood Partnerships on a guide for faith leaders to identify and help youth who may be at risk for suicide. We're going to talk through many of the key aspects of that report, and I hope you'll consider what steps you and your congregation can take. And I hope you'll take time to review the full report in our show notes. If you're tuning in for updates on the special session of the Texas legislature, don't worry. Texas Impact will have multiple opportunities for you in the next few weeks. Keep an eye on texasimpact.org for opportunities to hear from the Texas Impact team and other advocates and policy leaders about how the session's going and ways that you can get involved. I shouldn't have to tell you by now, but I will. The best thing you can do is to sign Texas Impact's Public Dollars for Public Schools letter and invite your friends to do the same. We're hoping to hand-deliver 10,000 signed letters from Texans of Faith to your representatives, so make sure to sign and share widely. Learn more about how you can get involved at texasimpact.org, and as always, I am here for you. So let me know if you have questions at scott@texasimpact.org. But for now, I hope you enjoyed this week's conversation with Reverend Dr. Sarah Lund. Joining us for today's conversation is Reverend Dr. Sarah Lund, Minister for Disabilities and Mental Health Justice with the United Church of Christ. Sarah, thank you so much for joining us today.
Thank you, Scott, for having me here.
I know we have a lot of UCC listeners, and so they will be super excited that you are with us. So I really do appreciate the time today. So first of all, let's start out with a little conversation about your role with the United Church of Christ. Start out telling us what you do. Are you a lobbyist, a policy interpreter, something else?
The United Church of Christ, our mission is to build a just world for all. And so we encourage all of our members to be involved as advocates for justice. And so in my role in the national setting, I work with our ministries of disability justice and mental health justice. So we are advocates for equal access to care, to resources, to support, and for parity, treating mental health and disabilities as we would any other condition that people need support for and medical care for. And especially with the ADA always in jeopardy, we are advocates for accessibility for all in our communities as well as in our faith communities.
I have to ask you, has your work ever brought you down to the great state of Texas?
Well, I was a graduate of Trinity University in San Antonio,
right.
So I have a place in my heart for Texas for sure.
I love it. The reason we brought you on today is we're really interested in your work, first of all, your role with the UCC, but also the alliance that partnered with the United States Health and Human Services Center for Faith-Based and Neighborhood Partnerships. Y'all worked on a guide for faith leaders to identify and help youth who may be at risk for suicide. So talk to us about that partnership, how it came together, the goals, and the role that you played.
Well, each administration has had various opportunities to network and support the faith communities, realizing that to make real community change, we need to engage leaders that are involved and invested in their local communities. And that's the gift of the faith community. We have those relationships. And so we work with the Department of Health and Human Services to help bring education and resources to people, everyday people. And so the faith community is a place where we can do education, we can provide access to resources. And as you know, the Surgeon General called upon all of us to be aware of the crisis we're in facing mental health. There's a loneliness epidemic, and especially our youth are facing higher rates of depression, anxiety, and tragically suicides continue to increase. And so the faith community, we have resources that others don't. We have intimate access to families and people's lives. Faith leaders are often the first one that hear about a tragedy and illness, people's despair and fears. They talk to their pastors or their rabbis, and we're often at the bedside of people in the hospital and in their homes, holding their hands and praying with them as they navigate the crisis they're going through. And the other thing that faith has is hope. We have messages of hope, messages of encouragement, and we also build community. And so one of the things we can do to help combat these high levels of suicide and loneliness is to always encourage people to come together in community so that we don't feel isolated and alone.
Yeah. We're going to dive into the report here in a few minutes, but I'd love it if you could just take us behind the curtain of what those meetings look like. What was your role? How'd that work product come together?
Well, there's a diverse group of us. And the most recent meeting I was at had the Muslim community, the Jewish community, Christian community, communities of color, and we're sharing best practices. And I am inspired by what faith leaders across the country are doing, especially now, given the state of the world. It's important to highlight that out of Stanford, there is a Muslim leader, a professor at Stanford, who is creating mental health support resources for Palestinians and for other Muslims who are struggling about what to do in the state of conflict, as well as Jewish communities who are also putting together mental health resources, and Christian communities. And so youth are getting involved. And so at our most recent gathering, we had a panel of youth sharing about how they have become leaders among their peers, really breaking the stigma and saying, it's okay to say you're not okay. It's okay to get access to medications, to get counseling and therapy. It's not a sign of weakness. It's a sign of great strength. There was also a panel about men's mental health. And so that was really incredible to see a panel of men talking about their vulnerabilities and when they feel overwhelmed, scared, afraid, and sad, and the ways that they have been able to ask for help and get therapy. One of the pastors says, let's normalize therapy instead of trauma. What if it was just, everybody had a therapist? That's what I say too. We take such good care of our teeth. A lot of us have a dentist. We go see them for a checkup. What about taking care of our mental health and getting a checkup from the neck up, at least once a year, twice a year?
I love that. Y'all are doing some incredible work. And the report that we want to highlight today, we're going to list in the show notes so folks can make sure to find that. Has been a really great resource for one of Texas Impact's teams that's working on gun violence and suicide prevention, and has a lot of great sections. I'll encourage folks to go take a look at the entire report, but I want to highlight a couple of sections today and get your thoughts. First off, you have a section that talks about the important role that faith communities play in suicide prevention. So can you talk with our listeners some about that?
This is a topic of a book I wrote, Blessed Youth, Breaking the Silence About Mental Illness with Children and Teens. And one of the key pieces there is to spend time truly listening to how our children and teens are doing. We're all so busy. Children and teens are busy, and we often just push through to get to the next thing. And we miss the subtle signs that our teens are struggling. My niece tragically died of suicide in 2020, and she was an overachiever, a straight A student, an AP honors student, and she was struggling behind a mask. And so masking is something we talk about when people are too ashamed to really hide their struggles. And so what we want to advocate for are creating spaces for children and teens to take off the mask. And a lot of faith groups have youth groups. And the one thing that would be such a gift to youth is if they could have a space where they didn't have to perform or prove themselves or show what they can achieve, that they're simply loved for who they are with no expectations other than being themselves.
Yeah. First of all, I'm so sorry to hear about your niece, and grateful that you're honoring her life with this work. But talk to us about what that looks like if congregations are doing that well. Do you have some examples of groups that have done that well?
Yes. So one of the examples is to train everyone in mental health first aid. There's a nonprofit, Mental Health First Aid. They do online and in-person trainings. It's an 8-hour training. You get a certification. They also have mental health first aid for youth. The reason why that's important is, like I said earlier, we miss the warning signs. We kind of gloss over, or we just assume things will get better on their own, when often things get worse on their own. So prevention is key. So faith communities that are doing this well, they're open about the conversation and they're proactive about the conversation. Other churches and mosques and temples have youth groups, and they're incorporating mental health conversations in every youth group, doing a check-in and kind of modeling the adults model, being really honest about how you're doing, and then sharing ways that you cope and support yourselves. They're also bringing counseling programs into their buildings. And a lot of folks have extra space in their buildings. So they're partnering with a local therapist to provide on-site counseling. And there's been some research out of the University of Miami that shows that bringing counseling services into the church building takes away a barrier. It destigmatizes mental health care. And so that's a really exciting way that faith communities can bring support to the people, to neighborhoods, and make it accessible and affordable.
Yeah, I love that. The next section I want to talk about are signs that we can watch for in youth. And I assume if we're having those check-ins, it's a lot easier to see those signs. But talk to us some about what those signs are that we should be watching for, and then how we should respond, or how we and/or faith leaders should respond if and when they see those signs.
Well, I think we need to acknowledge that the generation currently have a much different experience of the world than we did. And so sometimes we assume that because we survived, that they will too, and they'll just, it's hard. Life is hard. You'll get through it. But this is a different world today than the world we grew up in.
Right.
And so to acknowledge that when our teens and children, even young children, when they tell us that they can't do it anymore, that they can't get out of bed, that they don't want to go to school, that they don't want to live anymore, these aren't exaggerations. We used to say, oh, they're just trying to get attention. No, these are very common things that we're hearing a lot from our youth, that they are sad and depressed and very anxious. And especially for youth who might come from privileged backgrounds, there's an extra layer of shame. I hear this from youth who say, on the surface, it looks like my life is perfect and I have everything. And people don't believe me when I tell them I'm struggling. And then you have other youth and children who are in lower income, socioeconomically challenged families, and they have extra barriers because maybe they don't have the support at home. Maybe they don't have the funds to go to a therapist, and there's a long wait list. And so I think the thing I really want our listeners to know is that at any sign that a teen or child is struggling, treat it like it's a sore throat or a fever. These are symptoms telling us that something is wrong. Also, if their eating habits change, if they stop eating or start eating too much, if their sleeping habits change, sleeping too much, not sleeping enough, if they don't want to go out, if they're not connecting with friends, these are all signs of disruption and isolation. And if they start giving away their prized possessions, like my niece did, she was giving away her favorite watches and sweatshirts, and her peers thought she was so nice and generous. They hadn't been trained to know that those are signs that someone is planning to leave this world and they're giving away their prized possessions. And then if somebody says, I want to die, sometimes it's very explicit. And we kind of just joke it off or say, oh, you're not serious. When they say that, the follow-up question is always, do you have a plan? And so for us to get comfortable saying, do you have a plan? And then I'm worried about you. Let's call 988. So 988 is a new resource. It's a hotline for suicide prevention and crisis care. It's confidential 24/7. There's trained therapists that answer the call. And so if you're concerned about yourself or a friend or a family member or a colleague or coworker, call 988. And that is where you can get live on the spot support. There's a lot of impulsivity that goes into suicide. And so that immediate window of feeling the impulse is critical. And so it's something to really not delay, but to take action on right away.
So 988 is step one. Any other steps listeners or faith leaders should take if they see any of these warning signs?
To create a safety plan. And so a safety plan is, are you safe at home? Do we need to talk about putting away knives, putting locks on guns, right? Putting away medication so there's not an overdose, putting away alcohol. It's so tragic how easy children have access to guns, medications, alcohol, and knives. These are all ways that children are hurting themselves. And so making sure our homes are safe places.
All right. Another important piece of this report that I want to make sure that we highlight is about preventative steps. So any recommendations on preventative steps that listeners can take?
Prevention is all about normalizing mental health care, just like we do the dentist. And so a key preventative step is that all of us get a mental health checkup. And so find a local counselor, a therapist, and have that proactive relationship so that when trouble comes and a crisis comes, you already have someone that you can seek for care. Also, being in community. We know that having support is important for our proactive mental health. So that's where the gift of faith community, it's not always just about the beliefs or about the worship service. It really is about those relationships we make, people who know your name, they know what you're going through day to day, a place where you can say, I'm having a bad day. I need help with this. Also to be thoughtful about your own mental health, right? So many of us are caregivers professionally or in our families. And for children's mental health and the research I did, the best thing a caregiver for a child, a parent or grandparent, the best thing we can do to help the mental health of children, take care of ourselves first. Our stabilization, the ways we moderate our moods, the ways we model wellness, it's contagious. Hope is contagious. And so the more that we're feeling balanced and hopeful, the more that will help our children develop those same resiliency skills.
Yeah. I know this isn't an area that faith leaders like to plan or prepare for, but how should faith leaders respond if or when our community has to respond to a suicide death?
Showing up is critical. The power of presence and no judgment, not bringing any kind of blame into the situation. People already feel tremendous guilt and shame around it. And so a presence of unconditional love for the person who has died and their loved ones. And also being open about the death by suicide, because it's important to name that to help grieve. Suicide deaths have very complicated grieving. And so if we can name the cause of death, that will help acknowledge the deeper trauma of someone taking their life. And safe language is important. We never want to give any details as to the means of suicide. Why? When you describe how they died, you're giving people visual images of how to suicide. And you do not want to do that because there is a window of contagion. Once there's a suicide, people are vulnerable to suicide themselves. And so you want to be very careful in how you talk about it. And then you want to be extra supportive to those around them. If they don't want to be alone, making sure they're not alone, checking in on their mental health, scheduling a counseling session for the family who are grieving. And it's an ongoing grief. And so I think those are all important things to be aware of. It's a profound tragedy that often leaves us with so many unanswered questions.
I think this has been a lot of really helpful information about how we can respond in our communities, in our faith communities, with the students and I guess everybody in our circles of influence. But we are a public policy podcast, and I do wonder if you have any asks that you wish our listeners would take with their take to their representatives as they have their meetings. Any legislative requests for our representatives?
Yes, we still need more funding for 988. So each state has to create their own funding sources for that. And so we really want 988 fully funded because it's usually a 3-part process. There is a number to call. And so you want trained people to answer the call. You want a mobile crisis unit if people need to be served where they are by trained people, and then a safe place to go. And there are not enough safe places to go. And so we need to advocate for more funding, for more beds, especially for children and youth, because there's a wait. You have children waiting for days in emergency rooms to get a bed. I have a nephew who didn't have a bed when they needed psychiatric support at the hospital, and they turned a janitor's closet into a room for my nephew. And that's not acceptable. And so we need funding for more professional, culturally sensitive care. We also see high numbers around LGBTQ youth, and there are not enough services that provide supportive care for LGBTQ youth who are having a mental health crisis. We also need more funding for schools. For Black and Brown children, the best way to provide them support, we've seen in our research, is through the schools. And so how can we bring social workers, therapists, counselors, nurses into the schools and provide care for our children who are in desperate need of support?
All right, Sarah, this has been a really important but hard conversation. I really appreciate you taking the time to talk with our listeners about it today. Any other shameless plugs or closing thoughts that you'd like to leave with folks today?
I also want to say that gun safety is critical. And so I would advocate for safe gun laws. And there are organizations that will come to your community and share gun locks. You know, if it's simply a matter of making sure your weapon is locked so that it is not part of this tragedy and higher rates of suicide. The good news is that people of faith, we have communities of hope and care, and resources are available. Blessed Youth, Breaking the Silence About Mental Illness with Children and Teens. And I created a survival guide in dedication to my niece, Sydney. The survival guide is a safety plan, and it's a pledge that all of us, when we have thoughts of harm or suicide, that we would tell 3 trusted adults. And so those are available at Chalice Press. Thank you so much for the good work that you're doing.
Reverend Dr. Sarah Lund, remind listeners, where can we find more information about your work with the UCC?
Just go to ucc.org, and there are action alerts you can sign up for, and you can learn more about our mental health network ministries and our disabilities ministries there.
Excellent. Well, thank you so much. You've been a blessing to our group today, and really appreciate your work. Thanks again for joining us.
Thank you.
I hope you enjoyed the conversation with Dr. Sarah Lund. I know many of us have either experienced a loss by suicide or are part of a community affected by it. I appreciate Dr. Lund taking the time to talk to us about the warning signs and best practices, and I hope this is a useful tool for you and your congregation. As we close out this episode today, I'd remind you that the Texas legislature is in full swing, so make sure you are plugging in at texasimpact.org to find out how you can get involved. While you're there, I hope you'll consider joining Texas Impact to support this podcast and the work of Texas Impact year-round. And with that, I think it's time to close out this episode, so remember, the world needs Texans of faith active and engaged. So let's get to work.
Weekly Witness is hosted by Scott Atnick, engineered and produced by David Fasalo. Our executive producer is B. Moorhead. The opinions expressed on Weekly Witness are those of Texas Impact and our guests, and do not necessarily reflect the views of our sponsors. Weekly Witness is a product of Texas Impact, people of faith working for justice. Visit us online at texasimpact.org.